Thank you so much. Okay, I'm always slow at the uptick on this kind of stuff, so I apologize. But anyway, I'm really excited to be here because I have practiced medicine for 30 years and in an integrative way. Very quickly out of residency, I found that most people that were coming in for anything, whether it's a sore throat or fatigue or chest pain, I felt like I had zero things in my toolkit. I was putting people on medications, and those medications were causing side effects. And even if I was talking about therapy or physical therapy or social, psychological therapy, it felt like something was really missing. And we don't get taught the power of lifestyle. At least we didn't when I was training 30 years ago. And as my career progressed and as I discovered something like acupuncture, which was very holistic minded within a few years of my practice, I started the practice of acupuncture, changed my whole outlook on healing versus putting out fires. And what I really want to emphasize is the amount of control people have in their future destiny of health because they have so much power of the choices that they make that are lifestyle. So most of this lecture really is about empowering people to understanding how much control they really do have in spite of their genes, in spite of their environment, in spite of the pollution and the soil issue. But if we can capture the power of lifestyle, we can really, really change and push forward healthy aging. So what I want people to kind of think about is, why is chronic illness coming up so much? Why do we have such an epidemic of different chronic infections, chronic illnesses like heart disease and diabetes and autoimmune disease, neurodegenerative disease? What is going on? Why is this happening? And what is their connection to environmental issues? What is the connection to stress, our own stress, our thoughts, our fears? And how can we manipulate this? What are the early signs? And what is it that I control versus I have to go to a doctor's appointment? Now, this is not saying that you should not see a doctor. This is not saying that you shouldn't have a provider. This is just about talking about the role of what you can do as an individual. And it's very, very empowering. So when I learned all of these through the course of the last 20 some years outside of residency and medical school, I really am so excited about it and passionate about it. I want to scream it from the rooftop, which is why we also wrote our book, to try to empower people. But having a step back, I want us to talk about, when you listen to my talk, think really deeply on, why did you sign into this lecture? What is your why? What are you looking for? And it's not necessarily, I have hypertension, I have diabetes. It could also be things like, why am I so tired? And why do I have so much pain in the morning? Why am I gaining so much weight? And my sport performance isn't as good. I'm not doing as much as well as I was on timing. I take longer to recover. What about my genes? My mom had pancreatic cancer. What does that mean for me? And feeling like you're just aging faster. I have Hopkins in my backyard, and a lot of my patients come after seeing very smart doctors who are very well trained, but they get told things like, well, what do you expect? You're getting older. That is never a good answer for me. I'm never satisfied with that answer, because the physiology of how we age and how we break down is very personal and very unique to someone's genes, someone's gut microbiome, someone's lifestyle choices. So we really want to tease out what is in our control and what is not in our control. And maybe something is just, I just want to learn more. I want to educate my family. I want to help other people. And that's fantastic. So just think about, what is your why, because I'm going to come to it at the end of the lecture. So as I said before, it's an epidemic of chronic illness. We are having much more cardiac issues, many more cancers, and earlier onset, a lot more autoimmune disease, metabolic issues like diabetes, neurodegenerative like Alzheimer's and Parkinson's, and movement disorders. And it's really, really scary as a concept, because our genes haven't changed. So what is going on? Is it our soil? Is it our water? Is it our stress? What is happening that we actually have control over? So the other issue is also, it's not just limited to adults. Even in children, we're getting earlier metabolic issues, diabetes, not even type 1, which people are born with. They have a genetic predisposition. Sometimes their pancreas doesn't work. Sometimes it happens after a viral infection. But we're seeing type 2 diabetes, which is the type that really is associated with obesity. We're seeing an epidemic of obesity in children. We're seeing shingles, which used to be a function and an illness of elderly. When I was first starting to train, it was something we saw in 65 years and older because of your immune system. What happens is you get the chickenpox virus and it hibernates within us. And then when your stress levels go high, it starts to break out, and the breakout is called shingles. And that is happening not just at 65, it's happening at 50, at 30, at 35. We've just changed the recommendations for getting people shingles vaccine at 50. And I have people in their 40s getting shingles. So it is just the concept of what is going on with our immune system. And all of this is tied in to our immune system, which I'll expand about later in this lecture. Currently, when I first started practicing medicine, this was why I was frustrated, because I felt like I had very little tools for my patients to feel well. I had medications, which I use today. I have supplements. I have, referral for surgery. I have rehabilitation. We have injections. We have procedures that you can do under anesthesia. You have procedures you can do under, integrative radiologist. We also have therapies. We have therapies, physical therapies. We have psychological therapies, and everything has a role. But what is not discussed enough is the role of lifestyle choices. And that is, I believe, one of the most powerful tools we have in combating inflammation. Currently, the model for medicine in most traditional practices is whack-a-mole, which is you wait for symptoms, you wait for an illness to happen, and then you whack it, and then you treat it. And then you have side effects sometimes from the medications that you're treating. And polypharmacy is a really big problem as we age. What that means is that we're using more and more medications combined with different side effects, and sometimes their interactions aren't great. So they're not getting metabolized. So then you're building up metabolites of the medications. So a bigger concept would be to understand, why am I getting this illness? Because one intervention in a lifestyle pathway, unlike a drug, which only really works on one singular pathway and typically only for one illness. And because we have multiple illnesses as we get older, hypertension, diabetes, heart disease, history of stroke, maybe some movement disorder, all of those will require different medications. But sometimes when we employ lifestyle techniques, we can knock out so many of those, because the root cause of inflammation is what ties a lot of them together. And inflammation is 80% focused in our gut. And that is what we're going to spend a lot of time on today, talking about our gut. But really what the connection of everything is inflammation. And those cells which make inflammation are our immune system. And these are white cells, they're cytokines, there's different words for them. We heard a lot about it with COVID. But really what the issue is that our body is telling us that there is a danger and we have to pay attention. We're currently practicing sick medicine versus well medicine. And well medicine is even when you feel well, even when you're not having an ache or a rash or a headache, you're thinking about, how do I keep my body in balance? What are the things that I can do to kind of maintain homeostasis, which is a balanced state for my body, so that I don't give it enough room to break down? And what we are doing most of the time is we're not paying attention to what our body's telling us. We are seeing signs and symptoms all the time. Some of those questions I asked in the beginning, which was, why do I not recover from my workouts as fast? Why am I gaining weight in the midsection? Why do I feel so tired in the afternoon? And it is not most of the time because you're older. It is not because you're 40 or 50 or 60. It is because your body is out of balance. And many, many of our current treatments also have side effects. So the side effects of the medication. So for example, you go to your doctor, you have knee pain. And the knee pain, you get on ibuprofen, which is Motrin. There's prescription strength for that. You keep taking that and you have a stomach issue because ibuprofen breaks down the gut. So then you get put on Prilosec, which is an acid blocker. And then Prilosec has a side effect, which could cause a kidney dysfunction, or it could raise your blood pressure. And then now you have to go on a blood pressure medicine. So as you can see, some of this is just kind of one after the other breakdown, and not really addressing, well, maybe it's because I sit too much and I've gained 10 pounds and my knees feel bad. So maybe the answer is not just taking Motrin, but also maybe I need to move more. Maybe I need to stretch more. Maybe I need to go on, do some physical therapy. Maybe I just need to walk. So again, just kind of thinking big picture, keep thinking about lifestyle. One concept I want to bring up, outside of just, whack-a-mole, which is wait for something to break and then deal with it. The opposite of that would be to kind of create resilience in your body so that we age gracefully. So we're not waiting for things to break down. And the World Health Organization basically has told us that health is not the absence of illness, but physical, mental, and social well-being. So it's not just about physical well-being, but it's mental and it's social and it's spiritual too. So in our longevity data and our studies that are coming about aging, relationships are really important. What you have passion about is really important. And some of you may have watched the Netflix documentary on Blue Zones, which is, I think it's called Centenarians, but it's based on Mr. Buettner's, concepts of aging, which was fantastic. That came out in the 1990s. And we are still trying to play catch up with that because there are countries and communities around the world that are aging gracefully, that don't necessarily go to a gym, that don't necessarily have concepts of where they're keeping time every day for doing regimented things, but their actual life is very much about walking in nature, being with they have great relationships, they're eating fresh food, they're walking everywhere, they're carrying their groceries, they're doing things to make their muscles remember, and they're using their normal body concepts to kind of keep living. So another concept that I'm not going to talk about in this lecture, but one thing that we have in this country that's very different than the concepts that were seen in that video, in those documentaries, is loneliness. We're a very private, kind of a lonely community. So bringing relationships back in and making time to create really great relationships, but also prioritizing time to be with people that you care about and you enjoy is really, really important. So, what are our stressors? So, at the end of the day, my conception of what illness is and what is caused by is a series of stressors on the body. And stressors can be things that we control. Stressors can be what we eat, how we eat, when we sleep, how do we move, what do we pay attention to in terms of our thoughts, who do we spend time with, and what do we think about? All of these are very much in our control, and they are very much, when they're not being thoughtful about or intentional about, they can turn into stressors for us. Also, oral hygiene, extremely important. The bacteria in our gut is equally as important as the bacteria in our gut, in our mouth. So oral and hygiene, when I say hygiene, I mean microbiome in the body and in the oral health. And maybe there's things that are out of our control for stressors. Let me just define stressors for a minute as stressors are things that require our body to change. And stressors are not good or bad. They're just things that ask our body to change. So these are particularly not great. These ones that are out of our control. Sometimes we don't get born. We're not born with good genes. We have pollution. We have soil issues. We have environmental pollution, soil pollution, water pollution. We have family stressors. We have work stressors. We have maybe a boss that doesn't understand us. We have caregiving issues where we're taking care of parents and children. And so stress is real, but infections are real, and where we were born. Sometimes it matters where we were born and when we were born in terms of what kind of toxins we were exposed to. So all of these matter, and I'm not minimizing any of these, but really the thing is about trying to figure out what is in our control. So our bodies are very, very attuned to they want to be resilient. They want to stay in balance. So it gives you a lot of clues. And so our balance concept or homeostasis concept is based on the fact that there's a balance between our stresses and our resources. And today we're going to be spending a lot of time on talking about what we can do about these. What are our resources to combat the things that we may not have control about? I'm not in control of the genes that I was born with. I'm not in control of my environment. And I'm not in control most of the time of the pollution in the environment, as well as maybe the soil and where my foods came from. But I am in control of my sleep patterns. I am in control of my thoughts, and I can move more. So these are things to kind of think about conceptually, because these can actually break us down. All of these things in the stress column can break us down, they can create inflammation in our body, and they can lead to illness. So we have the concepts of balance, right? So our body's always in balance, trying to maintain balance. So we have many, many tools outside of the ones I listed earlier, which are medications and surgeries and therapies. We also have the concept of exercise and movement. It's not just about going to the gym. Really is about sitting less. We have yoga, we have clean water, we have meditation, we have plant-based diet, we have restorative sleep. We also have two things that aren't listed in this slide, which is fasting regimens, periods of rest for our gut, as well as our thought and our optimism for hopefulness for the future. We want to be able to create a hopeful environment that we think tomorrow will be better than today. This too shall pass type of an attitude. And science has shown that those kind of interventions actually make a big difference on longevity and aging. So let's get into some of the concepts. Before I do that, I just want to talk about what stress is. So there are, like I said, stress is not bad or good. When they did try to eliminate stress in the lab environment when they took mice and they kept them in stress-free environments, they didn't thrive. In fact, they died. So we need stress to help keep us growing and become resilient and to become more productive. So stress is not a bad thing. It's the amount of stress and it's the type of stress that we're talking about. So short-term stress, whether that's I'm training for a triathlon, I'm applying for a new job, I'm expecting a baby, any of those are things that we're requiring our body to change. But it is a stressor on our body, but it creates survival and immune protection if we can do it the right way. Short-term stress, often also like a cold or a wound, can last for minutes to hours, and it's experienced through different types of immune mediation called the innate and adaptive immune responses. The immune system is very complicated, so I'm not going to spend too much time on the stress response, but I want to just talk about what it does and why it's connected to the inflammation cascade. It works on white cells, which are immune cells in our body that are also loaded in our gut. So this is one of the reasons why we have such a large input when we can do things that make our gut happier, our microbiome happier, because these cells, like the dendritic cells, neutrophils and macrophages, are loaded within our gut, including mast cells. And when these things get activated, when these cells get activated, they start to release chemicals called cytokines. And those are transmitters in the body that ask for more help. So depending on what the insult is, what the immune system is trying to protect, because remember, the immune system is there to protect us from the foreign bodies, from the foreign concepts, the foreign things that it thinks it's going to injure us. It releases cytokines. And cytokines we heard a lot about during COVID. And cytokines can be related to signaling, and they can be good and they can be bad. You can have pro-inflammatory cytokines and you can have inflammatory, anti-inflammatory cytokines. So it really depends on an acute response. An acute stress response it's not bad or good. It takes into account a new threat to our body, and it starts to activate these things, which help the body get rid of the offending agent. When it turns into chronic, when it turns into long stress, hours and days and weeks and months, we can actually start to change that balance of cytokines to a more pro-inflammatory cytokine balance. It starts to change our innate and adaptive immune responses to kind of change the immune system that can result in immune dysfunction, which then can be in three different categories. So an immune dysfunction can look like, I can't fight this virus. I get sick all the time. Why does it take me 3 weeks to get over a cold, and this one gets over it in 5 days? That's a low immune system, and that's a dysfunction that can happen. Another type of immune dysfunction is allergies. So a low threshold for things that our body has seen already, a low threshold for things that are in the environment that we have been growing up with, but all of a sudden now we're intolerant to. It can be food, it can be bugs, it can be tick bites, it can be so many things. It can be something that the immune system is now very angry about, but before was okay with. So the threshold for tolerance can change as we go through a chronic stressor. And the other kind of concept of stress and breakdown is autoimmune. When the body says, I don't like this anymore, this guy, which could be our joints, which could be our eye, which could be our skin, looks like the bad guy. And the immune system says, I'm going to attack that. And that's an autoimmune response. And quite frankly, in one person, they can have all three dysfunctions. So it's not, it's very complicated. So it's basically a change in the cytokines, creating inflammation and a suppression of things that protect us. So when your body's too busy fighting what it thinks is the bad guy, it doesn't have enough ammunition sometimes to fight viruses, bacteria, cancer cells. So this change in this immune response, secondary to a chronic stress response, can really cause a lot of inflammation in the body, a lot of immune dysregulation in the body, and which ultimately can lead to inflammation. And again, every single medical problem in the medical textbooks have a component of inflammation, which translates into itis. An itis of my scalp can be psoriasis. An itis of my eye can be iritis or conjunctivitis. An itis in my brain can be memory loss. It can be anxiety. It can be depression. So as you can see, an itis isn't just sinusitis or bronchitis. It can be any organ can have an inflammation, and it turns into a symptom or a diagnosis. And that leads to a body on fire. So if you ignore those symptoms, if you ignore the, why am I so tired? Why am I getting joint pain? Why am I getting so many infections? It will ultimately can turn into an actual diagnosis, but we don't want to wait for that. We want to hit it before it actually does it. But now the beauty of lifestyle is that even if you have a diagnosis, even if you're on the spectrum of feeling mostly well and you have a diagnosis, anywhere along this path, you can actually make a gigantic intervention with lifestyle. Unlike some medications, when we find Alzheimer's patients currently with the illness, very few drugs right now actually make any impact on that. But in diabetes and heart disease and arthritis, we have lots of meds that make a difference. But what if we combine those meds with lifestyle and started to kind of move the needle back to when we were feeling really well? So this is not a one-way street. This is just the fact that if we ignore those symptoms, we can start to get something like a diagnosis of heart disease, arthritis, or diabetes. So what are these symptoms? Please tell me what I'm missing, right? This is kind of like you're sitting in your car and the engine light is flashing, flashing, flashing. And very few of us, or maybe none of us, would ever just put duct tape on that and just pray and just keep going. But we do that all the time with our bodies. We are constantly ignoring symptoms that our body is telling us. And some of that is, I'm so tired. Why am I tired? And honestly, this was my journey as well. I have begun the journey with integrative medicine, acupuncture, all because when I was getting out of residency, having children, starting my practice, I was always tired, and it was horrible because I had a lot to do in a day. And so I thought I was looking for things that would make me less tired. And I found acupuncture, which is an amazing intervention. But in the journey of finding acupuncture, I also found the role of food, how important digestion was. For me, when I found out how inflammatory certain foods were for me, I was already vegetarian, but as I went to become more plant-based and got rid of dairy, my energy levels went up. As I moved more, my energy levels went up. I could not figure out why, if I sat in traffic, why was I so tired? If I sat in traffic for 2 hours, why was I getting out so tired? I didn't do anything. And so the concept of stress on my body, stress in terms of constantly navigating and sitting all the time, started to kind of, make sense to me that I'm not moving. I'm very stressed out because of this traffic. So my thoughts were creating inflammation in my body. So when you start to tie in these kind of issues with yourself and what you're doing with your lifestyle, it starts to make sense. And when you make the interventions and the symptoms start to change, it's really a home run. So fatigue, digestion, so things that I can't tolerate nuts anymore. Why is that? Why can't I eat corn anymore? I start to feel really uncomfortable. So digestion issues, heartburn, indigestion, gas, bloating, constipation, right? So even, in medical school, I was taught that if you didn't have a bowel movement for 3 days, that's okay. That's normal. Well, I'm here to tell you guys that is not normal. Everyone should have one bowel movement at least every day. And we should be having sometimes up to 3 based on how much fiber we're eating. But digestion is a big sign. Bowels changing, stool changing. My patients know that when I talk to them, I'm always asking about their stool. What does it look like? Does it flush well? Is it sticky? Because those are clues to tell me that your digestion is working well or not well. Decreased performance. So I can't sit through a meeting. I can't seem to remember things as well. My boss is on me because I'm not as productive, right? Or maybe athletic performance. I'm more tired now on my same 5 mile bike ride. I need 2 days to recover. These are signs, along with weight gain and concentration issues and irritability and worry, right? So as we age, as we go through hormone changes, as we go through different stressors, we are going to be kind of inviting some of these symptoms to start. And what I'm asking is pay attention to them to understand that your body needs some more assistance. So one question I always ask my patients in order to find out what their personal trigger has been is, when did you last feel well? And people really have to think about this because you're so used to kind of being tired or kind of being sluggish or being achy. It's really hard to remember. Oh, well, maybe it was when I remember I felt really not great after I had that trip, or, when I went and swam in Indonesia, and I came back and I had a GI issue. And ever since then, I've been really struggling. And so that clues me into, maybe this is something parasitic. Maybe this is something in your gut that's inflaming you. Maybe this is an infection. Maybe now you have a leaky gut, food sensitivity. So it starts to really help us understand if an infection started it, a surgery started it, an accident started it, high periods of stress, a loss of someone, or a huge caregiving responsibility. Never underestimate the role that stress plays in terms of caregiving, in terms of taking care of children or parents, because that is a gigantic stressor for people, along with the loss of whether it's a spouse or a parent or a move. Like moves are one of the largest stressors, a loss of a job. If you start to kind of unravel those things, it helps us figure out what it was that can maybe we start with in terms of the testing. And I'll come to the testing later. But as we go through the motions, we want to think about, when did we last feel well, to help us understand what we can do about it. You go to your doctor, you're not feeling great, and you get a whole blood workup, everything's fine. Everything's normal. And that is because there are hundreds of markers of the immune system being angry, and we check for maybe 1 or 2 of them in our lab tests. So most of the time people come to me, and they are coming to me because their traditional workup has been, you're fine, there's nothing wrong with you, your blood work's normal. But I don't feel well. I'm gaining weight. I'm sluggish. I can't think anymore. What is going on? I'm so achy. There's something wrong. I don't know what it is. So one, there are multitude of tests out there. I'm a functional medicine doc, so I do tests for microbiome, we do tests for nutrients, we do tests for hormones, we do tests for neurotransmitters, lots of different things outside of the traditional blood work. So there is a huge array of testing that can be done, but quite frankly, sometimes we just never find it on a test. We just have to go with the symptoms. So some of the rationale that people have when people see me is, well, I wasn't going to come because what do I expect? I have so much going on. How am I supposed to feel? Which is how I felt when I was taking care of kids, working a full-time job, learning about acupuncture, doing all this extra stuff, taking care of my parents. What am I supposed to feel? I'm supposed to feel tired, right? So we don't have an alternate version of us. So we want to be able to understand that when you feel like this and when you're rationalizing like this, it is something that's still out of balance. I don't have time to worry about this. I have so many things to take care of. I heard that so-and-so said I should start doing X, Y, and Z, maybe walking 10 minutes or yoga. But maybe I'll start next week. What am I complaining about? Because the other person I know, she's dealing with cancer. So my little achiness and pain should be nothing. What's my problem? Why am I worrying about this? These are all negative talks about things that continue people ignoring their symptoms. So I really want to stress that if you're finding yourself think like this and you're not feeling your optimal self, still pursue a workup and start with lifestyle. So before I talk about what we can do, let me just speak a little bit about how we break down. So we talked about what stress is. what kind of stressors there are, and we talked about what inflammation is and what the immune system does. We have another area of how we break down, and that's called the autonomic nervous system. And the autonomic nervous system is really about the nervous system that is the sympathetic, which is fight or flight, and the parasympathetic, which is rest and digest. This nervous system is not volitional, which means I don't control it. It's subject to the stressors in my life and what I'm exposed to. And so it activates to keep me safe. It activates to get me out of danger. So the sympathetic goes up, for example, if I'm in the playground and I see my child fall from the monkey bars, then my sympathetic system kicks in. It's fight or flight. My heart rate goes up, my blood pressure goes up, and an adrenal hormone called cortisol goes up, which it should. It's trying to get me to move. It's trying to get me to flood my muscles with blood flow and get me to the point where I can help my child. So the same is true for if you're running, if your house is on fire, things like that, things that are really threatening to our system. So cortisol goes up, blood pressure goes up, heart rate goes up. Great. But after that, we're supposed to activate the parasympathetic system. These two systems can never be up at the same time. So when the sympathetic system is up, the fight or flight's up, the parasympathetic system is not. Parasympathetic system is our rest and digest. And rest and digest is what happens when we see animals in the wild. They go after their kill and their heart rate goes up, their blood pressure goes up, and then they pass out. They pass out for 10, 15 minutes because they're resting and they're digesting. But we don't do that. We don't do that as humans. We keep going and we keep going with fight or flight, fight or flight, fight or flight. The rest and digest keeps going down. And in my practice, this is what I think about when I see people. The separation of these two areas is where all the symptoms are. And these symptoms, I can't change people's lifestyle. I can't change the fact that someone has a bad boss or someone has to take care of their children and their grandparents and their mom and dad or whatever their life is. But what we can do is we can charge their parasympathetic. We can increase their, what I would call charge rate. It's just like you plugging in your phone. You're charging yourself up. So the separation of these two things is less and your symptoms go down and you start to heal. We want to put our bodies more in parasympathetic system using our vagus nerve because the vagus nerve innervates the parasympathetic system. We want to use this and charge our battery all the time because that allows our healing. Our bodies want to heal us. They want to keep us in balance. So we have to look for the signs and the symptoms and do the things that will activate that parasympathetic. What is parasympathetic? Parasympathetic system is rest and digest. So we work on digestion and we work on rest. Rest is sleep, but it's not just sleep. It's also what our thoughts are doing all day long. What am I thinking about? Am I afraid? Am I worrying too much? This is all affecting my parasympathetic and my vagus nerve. So that is that separation, which we'll also talk about today. Okay, so as we kind of go through our life, and even if you lived in the Himalayas, I'm sure there's stress responses everywhere. So if you are constantly affecting your sympathetic drive, I have bills to pay. I'm worried about my job. My boss is really being mean to me. I have to get my kid to soccer. I can't get this email out, whatever it is that's affecting our sympathetic drive. And remember, these things are not crazy, toxic things that your life is actually affected by in the sense of you're threatening your life. It is inconveniences and hardships that make the quality of our life not great. But our brain and our autonomic nervous system does not know the difference. We have evolved over thousands of years, and how we have evolved is that our body keeps us safe. So what were our threats before? Our threats were related to, famines, and our threats were related to injury or bodily harm or threats from different tribes coming at us. So we react the same, regardless of if you're sitting in traffic or your house is on fire or you're running from a tiger, that sympathetic system is still kicking in. So if you kept encouraging that sympathetic system about the worries and the fears and the things that are not going well, the cortisol goes up. And I'm not saying this is wrong. I'm not saying that this is just in your head. This is life and people have lots of stressors. But you're activating that cortisol, you're activating that blood pressure, and you're activating that heart rate to go up. So persistent elevations of this, high cortisol which cortisol is an adrenal hormone, but it has a lot to do with glucose regulation, which is sugar. Our glucose regulation affects our insulin resistance. And insulin resistance, which is the hormone that gets the glucose into the cells, insulin resistance is a big part of different metabolic issues. So if I kept my cortisol up and I kept my glucose elevated and my insulin was dysregulated, I can turn that into things like metabolic syndrome. I can turn it into heart disease. I can turn it into risk factors for strokes and dementia and diabetes, right? So there are precursors that you don't just wake up one day and have dementia. It has been a process that has been happening over years that can actually turn into it. Again, when we ignore our symptoms, we're ignoring the potential for reversing these things. Heart rate goes up and stays up. It can turn into what's called tachycardia. It can turn into arrhythmia. It can turn into atrial fibrillation. High blood pressure that stays up as part of the sympathetic drive can also turn into something like hypertension. And when people have insulin resistance and hypertension, they're at higher risk for things like heart disease and strokes, right? So even in women, for insulin resistance, we have increased risk for menstrual irregularities, polycystic ovaries, infertility issues. So what I'm trying to say is that this specific symptom of elevation can turn into, because of the immune system connection, because of the autonomic system connection, it can turn into multiple diagnoses that you see your doctors for. So we want to control that persistent elevation. Cortisol also, in addition to sugar regulation, has a lot of control over the immune system. Initially, when you have cortisol elevation, you are in an anti-inflammatory state, right? So you see when women, sometimes you see people, their child is stuck under a car and the mom lifts the car up and she's like, how do you do that? Well, that's a lot of adrenaline in her. And that's also cortisol that's protecting her spine and her muscles because it would hurt a lot if she did that, if she didn't have that cortisol. So it's an anti-inflammatory initially, but if it's persistent, it turns into those dysregulations of what I talked about before, which was difficulty controlling infections, difficulty with maybe allergies, and difficulty with autoimmune. And not everybody has the same breakdowns. Everybody's breakdown is very unique. The other big thing that cortisol does, it is the quarterback for all of our other hormones. So cortisol not only is our adrenals, which does a lot for us. It manages weight, it manages salt and potassium balance, it manages our energy, but it is also our wake up hormone. But it also affects multiple other hormones. As a symptom complex, these differences can look like weight gain. It can look like fatigue. And some people may have heard the term adrenal fatigue, which is a constant stressor that actually depletes your adrenals. And your adrenals are actually working, but they are not able to handle the stress that your body needs to handle because they're just getting depleted. So there's no dysfunction with the organ. It's just a kind of muckiness with the pituitary and the adrenals. So some people can have allergies from this, autoimmune from this, difficulty fighting infections. But one of the biggest things I see is weight gain. And why is that? Well, adrenals, also the cortisol, is the pyramid of hormones, can affect multiple other hormones. So your cortisol can affect your thyroid, which is in charge of your metabolism and your hair and your skin and your ability to go to the bathroom every day. And also it can affect all the sex hormones, your estrogen, your progesterone, your testosterone, which are actually very anabolic, means estrogen and testosterone builds us. It makes our bones, it makes our muscles. We are built by it. It's anabolic. But when we are in the cortisol phase, where we're trying to take all our energy and just trying to stay alive, our adrenals get all the attention from our body, and the sex hormones don't really matter. It does not matter if you're running from a tiger, if you want to conceive. It does not matter if you have a libido, if you are running from a tiger, right? So your brain is trying to prioritize what is important and trying to save you. So keep that in mind when you think about how much stress you're under. I have a lot of people coming in for me who says, I have no libido, I can't build muscle mass. And part of their problem is not necessarily just they're in perimenopause or menopause, they're stressed out. And when they're so stressed out, their body is not making the hormones that actually build us and help us conceive, and all of these other things that need to be done, or help our thyroid and maintain that metabolism. So remember that all the hormones play together in the sandbox. So when we think about breaking down, I'm also doing a lot of hormone testing to see where people are in their breakdown process. But cortisol is the big quarterback. So when you control cortisol, or you try to have a mechanism, you can make a lot of changes in these hormones without even taking hormones. So again, the immune system, cortisol can be anti-inflammatory. And then as it gets more dysfunctional, as the stress is more chronic, you can start to get more and more inability of the immune system as well as the hormone system. So where do I look at for vital areas to see for inflammation? Well, number 1, 2, and 3 is gut, right? Because we said that it's 80% of those immune cells are in the gut. So it can look like bad bugs, something called dysbiosis. It can look like heartburn, indigestion. It can look like SIBO. It can look like leaky gut or intestinal permeability. It can look like IBS. It can look like IBD. Any of those gut imbalances is possible from just being too stressed, just having too much stressors in your life without that balance. You can also, as I said, have hormone imbalance, and you can have lots of nutrient imbalances, because when your gut's not working, doesn't matter what diet you're on, you may not be absorbing any of those wonderful nutrients. So you have sugar dysregulation, which can affect nerves, your cognition, your metabolism. So you could see how just one system of breakdown can affect almost everything in the body, because everything is connected. So it is really important to kind of connect the dots like this and understand that inflammation is the thing. So, okay. So what are we going to do about this? This is a lot of information. I understand that there's all this breakdown. There's some things in my control. There's some things that aren't in my control, but we're going to focus on what is in our control. And that's what the resources are. And so basic concept is work on the parasympathetic, work on rest and digest, work on mind-body connections, on muscle mass, sleep, and diet. We're going to get into each one of these things. Okay. So what is the preferred food plan? I'm sure many people have different opinions about this. My personal opinion about this is about feeding the gut microbiome. The gut bugs in our gut there's 100 trillion colonies of gut bugs in our gut. And remember, the oral flora also matters. Our teeth, our hygiene of our gums, very important, because things that happen in here also can affect here and in our brain. And we're learning more and more that oral hygiene can be connected to things like heart disease, dementia, many, many inflammatory conditions in the body. So also focus on oral hygiene. But the gut bugs give us 3 million genes. We have 23,000 genes as humans. Our gut bugs give us 3 million genes. So we are a function of our gut bugs, because why? They not only digest our foods and take in the nutrients, but they also are in charge of our metabolism. They give us neurotransmitters that communicate to our brain. They help us think, they help us concentrate, they affect our mood. They can also affect the way we age, because the types of gut bugs that we have can make us more or less resilient to incoming stressors. How do we get our optimal gut bugs? Well, we want to eat fiber, and we want to eat diversely. So every single food that we eat that's plant-based can grow a bug. And what we want an army of good guys. Because when we eat bad foods and we don't digest properly, and we have a lot of inflammation in our gut, or our thoughts are really bad, or we take lots of antibiotics, bad bugs start to grow. So what do we want to do is we want to fortify ourselves and become resilient. So we want lots and lots of fiber. And fiber, prebiotics, probiotics are things that you hear about that help foster and grow good bacteria. The foundation of that are things like fruits and vegetables. Lots of fruits and vegetables. I tell my patients 7 to 10 servings a day, because they are loaded in not only nutrients. Each color of the plant or what you're eating will give you multiple different nutrients, but it'll also give you multiple different antioxidants, anti-inflammatory potentials. These are tools that our body gets from the plants and foods that we eat to fight off the bad guy. When we have stress in our body from pollution, from sitting too much, from thinking negative thoughts, we get oxidative stress in our body. We need plants to offset that oxidative stress, and those are antioxidants. Plants are loaded with them. Grains are loaded with them. Nuts and seeds are loaded with them. So everything on this slide is loaded in not only things called phytonutrients, which are lots and lots of micronutrients and nutrients our body needs to survive and do all those reactions that we need every day, keep us energized and vital, but also it turns on and off good and bad genes. So say I was predisposed to something like rheumatoid arthritis. In our gut bugs, based on the stressors we have, those genes can get turned on and off. So we want to fuel the bugs that keep those genes calm and keep those inflammation markers down. And that can happen when we eat diets that are high in fiber, that are diverse. I ask my patients to shoot for 35 to 50 grams of fiber a day. I ask them to do to create a diverse microbiome, because each food that we eat, if I had raw kale, it grows one bug. If I had cooked kale, it grows one bug. If I eat onions raw, it grows one bug. If I cook the onions, it grows another bug. So you can diversify your diet in many ways, even with the same foods. But I ask my patients, can you do 30 different inputs of food in a week? Okay, it sounds like it's hard. But if you think about it, if I have a smoothie and I put blueberries and blackberries and kale in there today with cinnamon, with nutmeg, with oat milk, with chia seeds and flax seeds, I got 8 right there. So lots of ways to layer this in many different avenues of your life. So it's not as hard as it thinks. You just got to start thinking about it. Maybe every time you go to the grocery store, you pick up a different fruit. Oh, I had kiwi last week. Let me try dragon fruit. Let me try an orange this week. You can diversify your berries. You could have blackberries and blueberries and goji berries and strawberries, and all of them are important, but maybe you do different versions of things every week. So that's the way you diversify. Also remember, spices are wonderful. We have a whole chapter of spices in our book because it's so important. But spices are little packed, high energy pockets of lots and lots of good nutrients, which have lots of antioxidants, lots of different colors, but they can incite lots of power into our foods that help us fight the bad guys. So a little pinch of turmeric or a little pinch of oregano or little pinches of, all of the rosemary into something is amazing. So think about spices, and they also count for that, towards that 30. So tips for healthy microbiome. I say shop in the periphery of the grocery store. Try to get the most whole food version of the store of the food. So what does that mean? Maybe apples instead of applesauce. Think about nuts and seeds and legumes. Lots of fresh produce if you can. As the weather's getting better, at least in my area, we're going to have more farms. We're going to have more farm to table options. We're going to have more farmers, bringing their produce out into communities. And so it's a really great time to eat seasonally, eat organic if you can. It's not essential, but these are things that are really very easy to do as the weather gets nicer as well. Drink lots of water. The water issue is very variable in each area. And there's a website called ewg.org, which kind of lets you know what your water problem is in your zip code. An excellent resource for lots of things, including how much mercury is in fish, what are the dirty dozens, which are the ones that you should try to get organic versus the ones that are not necessarily the safer 15, which is usually the ones that are not as essential to get as organic. EWG.org does a really good kind of summary every year that changes based on what's out there in the soil and the water and those kind of things. So, essentially, basically, if you can eat organic, again, not critical. What's more critical is whole foods, lots of them, lots of fruits and vegetables, high fiber, and diversification. So if you can get those 3 concepts down, that would be a lot better. And then you can branch off on that and see how you feel. There are also categories of foods called prebiotics, which give us the food to grow many bugs, right? So a lot of people take things called probiotics, which come in bottles, but they usually have 1, 2, maybe 7 or 8 strains max in them. And they are fixed a number of bugs, good bugs, that our body does well with. But remember, we have 100 trillion colonies, and we have 100 to 150 main strains of key bacteria that are essential for our livelihood and to keep us well. So when you think about a probiotic, it's good, but it's not the end all be all because it's just giving us the same version. So when people do take probiotics, I ask them to change it up every 3 months. But what prebiotics do is they are foods for the bugs. So they grow lots of different bugs. And this is chicory and onions and asparagus. And, you can see this list and you can find them in the grocery store. And they're not all, really easily found. Like Jerusalem artichoke is hard to find. But you don't have to do all of it all the time. You can just start with onions. You can start with bananas. You could start with things that are easier to find. So what you don't want to make this is a difficult, I have to drive 10 miles to that one grocery store that has this thing. Don't make it hard. Make it easy. Make it something at your local grocery store. You can make lots of changes very quickly with local stuff. So these are just resources, but you definitely don't have to do all of it. Probiotics I've listed here because this is also a question I get all the time. But honestly, you can create anything that's fermented. So typically probiotic foods are fermented foods. And I will tell you, as I have gone through my years of working with people with dysfunctional guts, not everybody can handle probiotics. Not everyone can handle fiber right away. Not everyone can handle prebiotics right away. It's a function of what your gut bugs are today. So if you are eating some of these things, Dr. Rao told me to eat this. I feel horrible when I eat this. It's because your gut bugs are not there yet. And we have to work slowly towards getting those gut bugs to be able to tolerate things. So you can start with maybe kefir, or you could start with maybe something that's like a sauerkraut, 1 teaspoon a week, 1 teaspoon a day, and just kind of grow your good guys. If you're someone who says, I talk about legumes and beans a lot as one of the most powerful foods for aging and longevity and also keeping our gut bugs happy, but not everybody can tolerate them. So what I'm talking about is really starting off slowly. And just because you can't tolerate beans, which could be for multiple reasons, your body's not making enzymes, you don't have enough stomach acid, and maybe the bugs in the gut right now are not favorable for it. But what we want to do is allow you to maybe start with more of a restricted diet, but then create an environment where the gut bugs grow and you can eat more things that are going to be tolerable for you. So say you can't eat black beans. Well, maybe you try red beans. Don't discount the entire food group because of the fact that one particular thing was hard. Maybe you cook it and you add something called hing, which is asafoetida, which is a spice that helps break down the coating of the beans so that you're not as intolerant to them. So there's many little tricks you can do, but don't discount plant groups as a whole large group because of the fact that, your one particular episode was not great. And I will tell you, there is no perfect diet for everyone. These are concepts, and this is why working with someone who kind of knows about different options for you as you heal and as you create balance in your body will be very, very helpful. But again, these are general concepts. Remember, add back spices. These are some of my favorites. There are so many spices. My cookbook has spices in there, but we're not limited to those spices because these are easy to find. I love fresh ginger, turmeric. I make teas with them in the morning instead of coffee. I have a turmeric ginger clove tea, which is super yummy. It wakes me up. It's very anti-inflammatory. It heals the gut. For example, the spices that I love, and I love them because they have lots of medicinal value. Remember, in old times, wars were fought over spices because they had tons of medicinal value. Turmeric is one of the strongest anti-inflammatories that we have. Turmeric has been shown to help with things like, cancer preventions and Alzheimer's disease. And, there's a lot of data out there on the value of turmeric. But essentially, cooking with it on a regular basis versus taking it as a supplement is also a really reasonable place to start. If you need to take it as a supplement, please work with your doctor. It does have some blood thinning effects. It does need to be combined with black pepper and piperine in terms of its benefits when you're using it. Ginger, an incredibly good gut healer. Ginger is great for nausea. It's also great for pain. So I love fresh ginger. If you can just shred it into water, if you can use it more in your foods. Wonderful. Garlic is a blood thinner. It's a great anti-inflammatory. It also has great antiviral activities. Rosemary is actually an anti-stressor. People used to smell rosemary because it lowers our cortisol, but it's a wonderful aspect of the Mediterranean diet. Some of the aspects of Mediterranean diet, which isn't discussed, is actually the role of their spices, like rosemary and oregano. Basil has also lots of benefits, and cinnamon is great for sugar control. And cloves are the strongest antioxidant potential out there. So I kind of throw it in my tea, one little clove. It also has antibacterial properties. So lots and lots of values of spices. I've done whole lectures on spices, so I won't get into it, but just please consider spices when you think about adding to that diversity of 30 different things, when you think how overwhelming that sounds. But you can use this in one day. You could have used all of these spices and you would have 8 going towards that 30 in the week, right? So it's very possible to do this with just liquids as well, not just foods. Okay, I just want to spend a second on how to read a label, because I'm always kind of shocked at even how physicians, we've never been trained in this, right? So we don't know what this means, but there's a little bit of just general facts that I want to talk about on how to read a label. First of all, I think everyone should get into the habit of looking at the foods you're buying. I had just told you to try to do things that are whole foods, not boxed, in the periphery of the store, which don't have boxes in them, which don't have jars and things. But, we're not going to all be perfect. So when you do look at a label and you're starting to look at things, look at, first of all, this is the old and the new. So most of the nutrition label should be what it says on this side, because of the fact that they've tried to include added sugars, which was very sneaky before they didn't add those. So you didn't know how much added sugar you were getting. And we really want to limit these added sugars to 0. We don't want added sugars. So first thing you look at is, what is my serving size? My serving size is 2/3 of a cup. It is not what's in the whole box, is not 230 calories, right? It is that serving size. And that gets to be really tricky, because some things are 1/4 cup and you're using 4 cups and you're thinking, I've only had 230 calories. But no, you've had 4 times that. So total fat is also listed here, and it lists it based on an RDA recommendation of what this daily value should be. And I will tell you that this changes, this saturated fat percentage will change based on the fact that you have heart disease or don't have heart disease. You don't want a lot of saturated fat at all, because of, if you do have anything that's predisposing you to heart disease. So the saturated fat, you look at that to see what that is. We want 0 trans fats. Trans fats are very inflammatory. We don't want any of that in there. And that should be taken out of most foods. There was, I think there was a few years ago, they decided that trans fats were very, very dangerous for us, so that we shouldn't put anything in our foods, but still on labels, that's why we check. Cholesterol also, oral cholesterol also in foods, right? So this is the way we actually, very few foods actually have cholesterol in them that increase our cholesterol. A lot of our cholesterol comes from genetic predisposition and what our liver is doing. And most of the signals for the liver is oftentimes carbohydrates. So just because you're eating no cholesterol foods doesn't mean your cholesterol in your blood work is going to be low. So sodium, very important to look at for lots of cardiovascular issues, and we want to also minimize that. We want that to be under 2,400 milligrams for the day, but that's being generous. We probably want most people under 1,200 milligrams for the day. And total carbohydrates are also very susceptible to your own issues. If you're diabetic, if you have insulin resistance, if you're trying to use for weight gain, weight loss, but not all carbs are equal. So do not shy away from carbohydrates, because most plants, most fruits, vegetables, grains, and even nuts and seeds have carbs in them, and they're so powerfully wonderful for us. So we don't want to shy away from carbs in general. We want to add fiber. So we want to look at this number called fiber. We also want no sugars. Added sugars is a big no-no. I would not do anything that has an added sugar. I believe this particular box was from a rice. So why the heck would we want to add sugar in a rice, right? So, but we do. There's lots of weird things that you wouldn't consider, and that's why looking at labels is very helpful. Proteins, also very, very important as we get older. And you'll see that certain, even rice, wild rice, red rice has more protein than white rice. So that might be a better option for some of us, right? So, and then they list the nutrients in there that are higher, but you're not going to get a lot of vitamin D from foods. Um, One of the things that I often supplement in most of my patients is vitamin D, just because you're not going to be able to get it as easily through foods. Calcium, iron, potassium. They list things, in as a function of how much is in there. There's definitely more stuff in here, but this particular part of the label does not list all the ingredients. But this is just looking at, your carbs, proteins, and fats and added sugars, which I think is really important to do as you're learning how to feed the gut microbiome and how to do better for your gut. Okay, so the other concepts, which I'm not going to get too much into, is because insulin resistance and diabetes is so prevalent and such a crux of the root cause of so many of the other medical problems that I see, like diabetes and with cognitive dysfunction and with weight gain and with polycystic ovaries, metabolic syndrome, so many issues, including for infertility. It does come down to how quickly does that food turn into sugar. Remember, I said all carbs are not bad. And I do believe that, but you want to look at how quickly things turn into sugar. If something turns into sugar right away, the sugar goes up quite a bit. The pancreas has to work really hard to make more insulin. And when insulin keeps surging really high to kind of keep that sugar down, because it keeps going up. So say, what happens is that this insulin level is fat promoting, it's inflammatory, it has a role. Insulin is very critical to us living because it helps sugar go into the cells. But if we're constantly pumping out the foods that have sugar in it, constantly doing that, it not only strains our pancreas, but it also allows for insulin to be resistant and insulin levels to float around really high. So we want to kind of combine our carbohydrates to complex carbohydrates. And this is one of the lists, and we want to try to shoot for more low glycemic carbohydrates. So this is a nice list of things that are quite shockingly, very high. And that's the white stuff, the white bread, the white bagel. And then something that's very low, are things like nuts and seeds and beans. I love beans for that reason. And lentils, they're proteins, they're carbs, they're just loaded in good stuff. And so really, when you look at this, you can start to combine things like, for example, I have no option but to eat a piece of toast, right? So that's going to turn into sugar pretty quickly. But I can put avocado on it, which is fat, and I can put some seeds on it, which is also going to have some fats and carbs in there, which will change the way that bread goes. It doesn't go immediately up. It'll kind of go slowly and maintain that sugar level. So if I can give you an idea of what this is talking about, is I'm eating oatmeal, package of oatmeal, because it's really good for me. It says on the box that it's really good for my heart. I'm going to eat it. And basically, it has no fiber in it. If you look at that label, it's all, and it may have some added sugar right in that packet. So what happens? Your sugar goes really high, and then your insulin goes really high, and then it falls really low because the sugar, and low sugar also is fat promoting. So now I have a high insulin, which is promoting fat. Now I have pushed down my sugar, and I have, again, another reason for, creating fat, but I'm starving again. In 2 hours, I'm really hungry and I'm craving something. So I go and I have, a granola bar. Again, my sugar goes really high. I look at the label. Wow, there's a lot of added sugar. There's no fiber in here. It's just carbohydrates because it's just turning into sugar. Straight up, it goes up. Again, in 2 hours, I'm plummeting again. This is what most of us are doing all day long. A huge source of fatigue post lunch is because of this insulin spike. So if you start to look at this list, you can kind of tailor maybe your higher glycemic foods towards the night and the lesser glycemic foods in the daytimes to keep you awake and alert, right? So you can start to not only eat well and feed the body lots of good plant-based foods, but you can also kind of regulate your sleep-wake cycle and also kind of your fatigue level during the day. Okay. So at the end of the day, the message is food is information. It is information for this gut bug. Carbohydrates are not the enemy. They are really important for cellular and brain energy, and they're more efficient for energy than fats and proteins. So you want to try to get more fruits, vegetables, dairy, grains. I'm not a big dairy person because I'm more plant-based, but some people, just as a concept, the dairy does have some natural sugars in there. It's also in pastries and candies and juices, but those are not equal. What's in a fruit and what's in a pastry is not equal sugar. And the way it raises your glucose is very different. So When you eat more carbs than you need, you will be stored as fat. It is not going to get stored as glycogen as much, which is the storage of how you store glucose in the liver. It's going to be stored as fat. We have a love-hate history with carbohydrates, right? We want carbs when we're tired, when we're stressed, when we're anxious, we crave carbs, right? So we have this intense relationship with it. So it's really important to also understand why we're kind of choosing for carbs. If I walk around all day, I'm so hungry today. What is going on? I'm just craving sugar. I want to think about, how did I sleep last night? What am I worried about? Am I really stressed out? Did I work out? So really think about the reason you're reaching for carbs. Another slide that looks at just the concept of the complex carbs and how good carbs can look like. These are good. These are sweet potatoes and white potatoes do have a higher glycemic index, and I'm not saying that they're good for everyone all the time, but they are complex carbohydrates, and they can have a role, especially if you're sleep deprived. These are sweet potatoes, really nice to have in the evening. It kind of induces more of a restorative sleep. So, things that can be, if you don't have diabetes, if you don't have a weight problem, maybe start using more of these complex carbs into your diets. And these are simple carbs, which are things that we want to stay away from: cakes and candies and refined sugars, syrups, juices. And so they are ones that don't have any minerals in there. Unlike fruit, they don't have any minerals or fiber or colors, right? So colors on these fruits are also really important. So all of these are not equal, which is the point I wanted to make. Okay. So there were studies that showed that, if you added fruit to a diabetic, like a blueberry, because it's got fiber, it's got antioxidants, it's got nutrients, it blunts the insulin spike. So counterintuitive to what we think, which is I'm eating sugar with my oatmeal, it is actually going to help you most of the time to kind of combat that sugar spike and that insulin spike. So bottom line, fruit does not adversely affect blood sugar the way that industrial sugar does, which is the cane sugar that's processed in most of the food. Having said that, one of the things that I have found are these wearable devices called continuous glucose monitors, which can really help people understand what their food intake and their activity level is doing for them. I can speak about this, but in different people's bodies, based on their gut microbiome, based on their medicines, based on their health, it can do different things. So at the end of the day, I have started recommending maybe 2 to 3 weeks of these continuous glucose monitors, which are not usually covered by insurance. You can get them, but they don't get covered if you're not a diabetic. But they're so valuable in inducing lifestyle choices, because what my patients have found is that they have found that they can eat blueberries with their oatmeal in the morning. But if they add cinnamon, that sugar spikes goes down. If they walk for 20 minutes after, that sugar spike goes down. So it motivates them to do more with lifestyle based on the same food that they're eating. Maybe I can't have my potato for lunch, but if I have it at night, it doesn't do as badly for my sugar. So those kind of things are what you get from wearable devices that is unique to your own body. And I love that, because it's that constant feedback, which allows for change to happen within you that you can sustain. So remember, it's not only what you eat, it's when you eat that matters, right? So there's the whole concept of fasting. And again, nothing is the same for everyone. So please talk to your physicians about if your fasting program is right for you. I do a lot with fasting, but I personalize it to each patient. So most people can fast for 12 hours. There's different types of fasting. There's one called time restricted feeds, which is 12 hours a day. Should work for most people. What does that look like? Well, I eat my dinner at 7 and I don't eat again till 7 a.m. And that works for most people. There are some people with sugar issues and diabetes and sleep issues that need a handful of a snack like nuts before bedtime. And again, everything is really based on what your individual body needs are. So time restricted feeds, I will have people work up to 16 hours of fasting. There's a whole section on, if you should work out before and all that stuff. We're not going to get into all that, but fasting is an incredible tool for balance. It changes our gut microbiome for the better. It lowers our inflammation. It can change our insulin resistance. So it can also reset our stem cells or our immune cells. So periodic fasting for 2 or 3 days a week can reset It can get people into ketosis, which is great for our brain. It also can help us retrain our gut microbiome. And actually creates resilience. It creates resilience for us to be able to handle the same stress. So I do encourage people to use different types of fasting regimens. There's also one called fasting mimicking diets, which is from a company called Prolon. They have a very good website, lots of literature on their website for reducing cholesterol and lowering inflammation and reducing insulin, and also lowering something called IGF-1, which has been implicated in certain cancers. This is not for everyone. Again, this is something it's a 5-day, you eat for 5 days of what's in those boxes. So those boxes will have, they'll have nuts and seeds, they'll have crackers, they'll have soups, they have teas, they have olives. They're gluten-free, dairy-free, but they have beans and legumes in them. So that what you see in the box is all you can eat for that day. First day is 1,100 calories, and every subsequent day is 800 calories. So it's a concept of really trying to get people to use different regimens of fasting. You're still eating. It's mimicking a water fast. When people have done studies for water fasting for 5 days, meaning all they do is water, their immune system changes at the end of it. So that is a totally different way to look at the immune system and modulate the immune system. So a great intervention, when it works great. You have to do it periodically during the year. And I could answer questions about it later, but it's another tool that is very effective in my practice. I just wanted to put this slide real quick on the shockers of how much sugar, added sugar, is very inflammatory, really signals a lot of badness in our bodies, can actually induce joint pain. Not only does it do the normal things we think about, which is, it makes me gain weight and it makes me get diabetes and sugar dysregulation, but above that, it can affect the way our brains think. It can affect the way our joints behave. It can affect overall body inflammation just with these sugars. So just shockingly how high some of these things are. And again, the goal for added sugar for most people is less than 5 grams per day. Okay. Here we talked about that. This is a lot. So I can go into more questions about, how people change their diet if we need to, but I'm going to try to get the rest of this stuff in because it's not just about food. It's also about, there's so many other lifestyle that we can do, and sitting is the new smoking, right? So we can, it is just as bad for us to sit most of the day than it is to be smoking in terms of its cardiovascular risk and its overall risk for dying. So we know that people who are mostly sitting have a higher fall rate even for people as they age. So it's not just about dying, it's also about losing your independence. And there are some new recommendations out there. Basically, we're trying to shoot for, there's a lot of words on this slide, but at the end of the day, 45 to 90 minutes a day is what's recommended to either moderate or intense physical activity. But the issue for this is really just do something, even if for someone who sat all day long and they walked for 10 minutes, that will help them with their health. That will lower risk for cardiovascular disease. So bottom line is sit less, move more. It doesn't have to be that you go to the gym. Maybe you can't walk to your mailbox today, but you try to get to your mailbox. Maybe at the end of the week, you try to get down your street. Maybe you just stand up between your meetings. But whatever it is, it's sit less. Okay. So I don't want people to be overwhelmed with the numbers here because it can be overwhelming, but it translates into about 45 to 90 minutes a day. But again, doing something is better than nothing. And there's lots of benefits with exercise. It helps with heart disease. It helps lower blood pressure, helps with weight management. It helps build muscle. It also lowers what's called one of the markers that I use for the blood called fibrinogen. It lowers fibrinogen levels as we exercise because exercise is anti-inflammatory. It decreases certain cancer rates like colon cancer, and it increases muscle mass. And when it increases muscle mass, it can improve your mental health. This is really powerful. It improves memory. It can improve our resilience to stress. So my actual stress response to the same exact sympathetic hit that I'm having can be very different in terms of its tax on my parasympathetic system if I have more muscle mass and if I exercise. Why? Because our brain has more endorphins, our brain has more serotonin, which is our happy juice, and it does better in terms of our perception of stress when we exercise. So the inflammation from that stress that is hitting my brain that translates to my body is less because I exercise. So the same life situation can result in many different inflammatory responses in the body if we add more muscle and movement and start to work on just balance and strength, things like that. One of my favorite things to share for most people who don't have to go to a gym, just as a morning stretch, a morning routine, is called sun salutations. And the reason I love this is because most of the day, as I'm doing now, I'm sitting. I try in my practice to sit on a ball or to do a standing desk, and I mostly walk around. But a lot of days where I'm on Zoom calls, I'm sitting. And so I try to do sun salutations or some of these poses in between patients sometimes because it works the back of my body, it works the extensor muscles, which can be very, very helpful. And if the stretching, the things that it does are the sun salutations. If you go through the whole thing, you can do it in 1 minute, 2 minutes. You can take 10 minutes, depending on how slow or fast you do this. But it works all my extensor muscles, which are asleep when I'm sitting. So as we wake up these muscle groups, we are less inflamed. As we wake up these muscle groups, we are less depressed. So we want to work on moving and stretching, and everything works. Even stretching has been shown to help with longevity. So, think about adding something even as a yoga stretch in between. Favorite home yoga person is Yoga with Adrienne. She's got wonderful tapes, videos online on YouTube, and she has something for everyone. Chair yoga for those people who have lots of knee issues. She has something for everyone. She has a detox yoga. She has a sleep yoga. She has a breath yoga. I mean, it's just wonderful. So please look at that. And like I said, there's other options if you're someone who has to do meetings all day, sit, stand, desk, exercise ball, take the stairs, park farther away, do things that make you sit less. If you're at your child's soccer game, don't sit, walk around, enjoy nature, do things that if we look for it, we will find ways not to sit. We just have to find those ways. This is one of my favorite poses between patients is because it wakes me up. It actually wakes me up. So my brain gets perfused. If I'm feeling sluggish or tired, I will do a down dog and it'll wake me up. But at the end of the day, you don't have to do anything. Make it fun. Just because I do yoga doesn't mean you have to do yoga. Find something, dancing with your grandchild, throwing a ball to your dog, whatever it is. Just find an activity that will make you be passionate about movement. Okay. So think about what I said about the timings, but also just start with things you love and things that make you feel good. Okay, so the other big intervention, we talked about the digest part of the parasympathetic. Now we're getting into the rest part of the parasympathetic. The rest part is sleep, and I obsess about sleep. Sleep is hugely, hugely important, and it is one of the first things we throw out the window when we're stressed. I do it too. It's like, well, I'll sleep later. I don't have time to sleep. I got to get all this done. But it is so restorative, and it actually makes us more efficient in the next day. We do better at our tasks. We crave less sugar. We make better food choices. We also have the energy to move more when we sleep well, right? And we also don't react to things as adversely when we're well rested. So restorative sleep looks like 7 to 9 hours, and it definitely has a benefit in cardiovascular health. It helps mobilize fat. It helps our hormones. It lowers our hunger hormones. It helps our satiety hormones. Another big area in my practice I focus on is detoxification, and sleep is where we detoxify our body. The cells in our brain, from all the reactions that it's doing all day, are actually cleaning house at night. The brain cells actually shrink, and there's fluid around that actually drains all of those chemical reactions and makes room again. It's kind of like decluttering your house. You have room to breathe, you have room to move, you have room to function better when the clutter is gone. And that's what we do in sleep. We declutter, we detoxify, we need to get the junk out. So not sleeping, we were walking around a little bit more toxic. We were walking around with a little bit more cortisol. We also heal in sleep. So our injuries, we grow in our sleep. So, adolescents with all this, stuff out there for them, not sleeping, It's affecting their growth hormone. It's affecting their memory. It's affecting their mental health, which is why some of the schools, including my neighborhood, has changed the start timing for their high schools because they've seen that, it has helped with mental health and it'll help them perform better in school if they sleep better. So don't underestimate sleep. Sleep deprivation has a direct link to obesity. Also, probably part of the problem in childhood obesity going up, because when we are sleep deprived, we increase our hunger. Our leptin goes down, which is just a satiety hormone. Our ghrelin goes up, makes us hungrier. We increase calorie intake. It leads to fat deposition. It also allows us for more hours. When I tell you, don't eat for 12 hours, but I'm awake till 2 o'clock in the morning. What am I supposed to do? And your brain says, I'm really tired. What do you want to do? I'm going to go eat some sugar. That's kind of our reflex mechanism. So when you next time get that signal of, I want to eat sugar at 10 p.m. at night, think about maybe that you're too tired and you just need to go to sleep. It alters our metabolism. It also increases our fatigue, which over time reduces energy expenditure, also leading to weight gain. And obesity has been linked to so many medical problems. And that's one of the reasons why those GLP-1 agonists are making such huge headways in lowering cardiovascular risk now, because when people lose weight, they're lowering their overall mortality and cardiovascular disease rates when they lose weight. So that is really important to consider. So please prioritize your sleep. Start removing your notifications. Start, removing caffeine in the afternoon. So there's this counterproductive thing that happens when we're very stressed out. We actually don't metabolize the coffee very well. So imagine this. You're so tired. You slept 5 hours. You have a cup of coffee in the morning. It wakes you up. By noon, you're tired again. And so you have another cup of coffee. And by 4, you have another cup of coffee. By 10 o'clock that night, which would be the solution for why you're so tired, is that you slept so late or you didn't sleep enough. You can't sleep because all that caffeine is now keeping you awake. And we have different metabolism of caffeine. Some of us are fast metabolizers, some of us are slow. I have patients who can have an espresso shot before they sleep, doesn't affect them at all. In other people with the slow metabolizers like me, if I have anything in the afternoon, it'll keep me awake. So everybody's an individual. So listen to your body and figure out if caffeine isn't a problem for you. Stopping electronics. The glasses to block blue light is a little bit controversial, so I'm not sure that's as effective. But maybe create some sort of sleep routine for yourself, reading books instead of your tablet. Watch TV, but maybe not watch things that are upsetting, like the news. I mean, I find that the biggest horror show on TV is the news. And so it's very disturbing to fall asleep with all this negative concepts in our brain. So try to read something or do something that's pleasant, and avoid LED lights in the bedroom, because LED lights tell our melatonin in our brain, which is our sleep hormone, to activate. So you basically have less ability to fall asleep if your melatonin is low. Okay, so this is part of, oh goodness, I have to go a little bit faster because I want time for questions. So this is one of my favorite parts of the lecture, because I am obsessed with stress and I'm obsessed with our thoughts, because I have found through my own life experience that if I think differently, if I've changed my attitude towards being more of an optimist, to being calmer, to do the things that kind of make me less reactive during the day, my body does better. I'm able to lose weight. My sports performance goes up. I sleep better. So many things do better. So these are all the techniques I usually spend a lot of time talking about. I'm throwing this on there because cortisol is so important. Cortisol, our stress, our worry, our fear response directly impacts our body, inflames our body. So do the things that help you sleep better. So simple things like 4-7-8 breathing. So if you breathe in for 4, you hold for 7, and exhale for 8. That just activated my parasympathetic system. That lowered my cortisol. If I do that 5 times in a row, it makes me feel better. If you do that multiple times during the day, fantastic. So these are tips that you can do because your breath is always with you, right? We have all heard someone say something to us or someone say something to someone else. If you are stressed, breathe. What does that even mean? Well, when you exhale longer than you inhale, you activate your parasympathetic, you activate your vagus nerve. There's exercises called yoga for the brain. It activates your right and left hemisphere because you hold on to your right and left ear, and you basically squat on the inhale and exhale on the uptick. So you're going down and up. And I do this when I'm doing a live lecture, so I apologize, but yoga for the brain is really restorative. It helps everyone kind of wake up. It's 15 ups and downs and that's it. But you're holding on to the right and left side of your ear, so it activates both sides of your brain, and it's very restorative. There's lots of organizations that teach people how to do meditations, the mindfulness-based stress reductions, transcendental medicine, transcendental meditations, art of living. They're all organizations that teach people how to breathe and meditate. There's apps on your phone, Insight Timer, Calm, Headspace. Walk in nature, take your shoes off, go outside every day, get the sun. Simple things you can do to try to activate your vagus nerve and lower your cortisol. There's also sounds. This is actually phenomenal. There's sounds that you can get on places like Spotify, where you put one pod in or one earphone here and another one here, and there's different frequencies in binaural beats. They're different frequencies. That's why they're called binaural. They negate each other, and they can calm your brain down. They can give you the frequencies where you are in sleep mode. They can give you the frequency of concentration. So they're an effective tool, simple, that you could do at home to help you concentrate better or help you fall asleep. So check that out too. Okay, so quick talk about vagus tone. I can spend a whole lecture on vagal nerve too. Gargling activates the vagus nerve. Why is the vagus nerve important? Because it activates the parasympathetic, it activates our rest and digest, it charges our battery. Singing in the shower, humming, chanting. When you sing, I'm not talking about, low sound singing. I'm talking about singing like you would in a church, really loud and kind of vibrate and, sing to the point where you're just almost like euphoric. That's the level of sound of singing. So I apologize if there's other people, if you're not a good singer like me. I'd only do it in the shower because I don't want to hurt anyone's ears, but that level of singing does activate the vagal tone. And breath work, and then cold therapy. That's a new one that I've been starting to do, cold immersion, and I can spend more time on that if people have more questions on it. And I want to end with our outlook. There's significant amount of literature coming on how our optimism or our outlook helps us age better, helps us recover from illness, decreases our ability to get illness. It helps modulate the stress response. It helps us choose healthier habits, but 11 to 15% longer lives. So if that was someone who was going to live to 80, they could potentially live another 10 years till 90 because their outlook is, I have more hope. Tomorrow will be a better day. This too shall pass. Strong interpersonal relationships and improved inflammatory markers have all been shown to be associated with just a better outlook. Well, how do you get that? Well, there's work in all of this. I personally was not an optimist at birth. There is a genetic predisposition for optimism. It's only 40%. So 60% of that you can change based on working on things with meditation, with exercise, with journaling. One of the best things I ever saw that kind of changed my practice on optimism was Shawn Achor's TED Talk. It's on YouTube, and it talks about how you can start to create more happiness in your brain, and you can do things in 5 minutes every day. And that involves gratitude. That involves journaling something good that's happened to you, not a bad journal. There's a role for journaling negative things, but there's also a role for positive journaling. And along with exercise and meditation is random acts of kindness. So doing something, even a smile, when you smile at someone, when you do something for the person in front of you at a Starbucks line, you pay for their, in back of you in a Starbucks line, you pay for their coffee. Small things do lots for good for our body. So look at that. Positive emotions also flood the brain with dopamine and serotonin, which are happy juice. They're motivating us. They're keeping us happy. They're keeping us less depressed. They improve our mood. They improve our learning. They improve creativity. They increase memory. So positive emotions, joy, curiosity, euphoria, things that are happy, pleasant, are things that we evolve to. And that's when you start cultivating a practice like what Shawn Achor talks about. Okay, so I've discussed a lot of things. There's a lot to do. There's plant-based, there's fasting, there's optimism, there's sleep. There's so many things. Where do I start? This is where I go back to what is your why? What was the reason you wanted to listen to this lecture? What is it that you're worried about? Are you tired? Are you finding that you are maybe not as active? Start with one thing. And maybe that one thing is, I'm going to go out for a 10-minute walk today. It's nice and sunny. I'm going to take my shoes off and walk in the grass. I'm going to try to look up a meditation app and see if maybe that's something I can do to help my sleep at night. Everyone's path is going to be different. This is why personalized medicine is so important. Things that work for one person doesn't work for everyone. And maybe you start with just eating more fruits or vegetables, or maybe you start with adding more spices. So start with one thing, and you will be amazed, because just as one thing starts to make us spiral downward, one's positive intervention will build on more positive interventions. And pretty soon you'll find you're in a different place, and you'll want to convert everybody to your lifestyle pathway. And it's not always a home run, right? So you want to work with your physician. There are things that are out of our control. There are things that this won't fix completely. So you still want to work with a provider. You still may need medications. You still may need surgery. It's not the end all be all, but it's definitely worth a great effort and an intention. With that, I think I will end. And if you want more information, it's Body on Fire book, and I will start to answer questions because I think I went over a little bit.
Yeah, no worries. Thank you so much for that very thorough presentation. So we're going to begin the Q&A portion of our session.
Should I turn off my screen then?
Yeah, you can go ahead and shut off the share. All right, perfect. Yeah, so thank you again. It was extremely thorough. So we're going to begin the Q&A. For people who want to ask a question, you can raise your hand in chat. For if you don't know how to do that, we'll put the instructions in the chat. So your style or modality of treatment is obviously very drastic than the mainstream treatment. How do your patients respond? I'm sure many of them seek you out, but do you get patients that are just coming to you as a regular doctor and then are surprised by your method of treatment?
So about 12 years ago, I changed my practice. Initially, when I tried to do this on my traditional practice, when I had 10 minutes a patient, I would basically blurb out one intervention like I did today at the end of our talk. Try to go off gluten, try to do this, and I'll see you next time. And I found that even that one little intervention made such a big impact. It was really interesting to me that, just giving them a meditation app and helping them sleep a little better. I found this out when I was an acupuncturist and I started doing acupuncture, and I was treating someone's carpal tunnel, and they told me that their gut was better. And I was just like, that's crazy. What does that have to do with carpal tunnel? And I started understanding that the whole body's connected through this autonomic nervous system, and all of these things are connected. So yeah, most of the time I start with diet, to be honest, because that has made the biggest difference for people. Within 4 weeks, they come back and they feel something better. Like my joints don't hurt as much and my sinuses are clearing up, or something's getting better. And I think what people need is to get the buy-in, because this is like first time they've heard this from a doctor. This doesn't make any sense. What do you mean you're not giving me a medicine? What do you mean this diet? What does that have to do with my pain? And so I usually throw a diet out or food plan out for each person based on what they're coming in for. And I have a follow-up usually in 4 weeks, and most people, 80% are somewhat changing. They're not completely cured, but they're getting better enough to buy into it, and they'll start to do more.
Great, thank you. And how do other doctors respond to your modality?
That's really fun. It's definitely getting more acceptance. When I first left my other practice that was more traditional, people thought I retired from medicine because they thought I was going to just tell people to meditate all day and, do acupuncture on them and not do traditional medicine. But to me, this lifestyle component, it actually is the real medicine. And so I have found that some people think they don't know that I'm still practicing internal medicine. They think I've retired. But I have been getting more referrals from other providers, including cardiologists, to say, I don't know what you did with my last patient, but they're much better, and I need you to do whatever with this person. So I think there's more buy-in. There's people seeing success. I've lectured to the American College of Cardiology about this, and so there's more acceptance on the role of these interventions as opposed to traditional medications and surgeries.
Thank you. Yeah, because we had Dr. Kim Williams on the other day, who was
Yeah.
the former president. So I'm sure he's helped kind of.
Oh, yeah. I mean, totally. There's definitely a mind shift change in the last 10 years.
And have you gotten any negative pushback from, from the industry? Obviously, you've got a pharmaceutical industry whose business model is sell pills and whatever their medications are. Has there been any pushback from that, given that I imagine your modality doesn't sell as many pills?
There's been one interaction I've had with another provider that called me about a patient, because when I see someone who's not in danger and they have hyperlipidemia or high triglyceridemia, I will tell them that I want to show you what power you have. I'm not putting you on a medicine right now because within the next 3 months, I think you'll be safe, but you will need to do this so that you know what power you have. And I won't put them on a medicine. And I got kind of scolded by another physician saying, "What are you doing? Why are you not treating this person for X, Y, or Z? Because they're at danger of having a heart attack or stroke." And I basically responded with, "I know that, but they're not in danger right now, but there is this opportunity for them to realize how powerful their lifestyle choices are. And I don't want them eating their steak and just taking a statin. I want them to understand that there's power and they'll feel better because the medicine only can do one intervention. It's not going to actually give them energy or help them sleep better as lifestyle can do." So I did get some pushback with that. I occasionally get the pushback from a drug like Ozempic, where they come and tell me that obesity is a chronic medical problem. The patient should be on it for the rest of their life. I don't believe that to be true. I believe that to be a segue or something that is a bridge for someone to initiate lifestyle, to make them feel better, to give them more energy. And some people need to stay on the medicine for the rest of their life, but most people can make these changes and kind of settle in a new baseline that's not needing medications, or dose changes can also happen. So maybe they can't get off the med, but the dose can change.
What are the first signs of chronic inflammation people should look out for?
So I had spoken about that in one of the slides about it can actually look like anything. And for me, it looked like a ton of fatigue and tiredness in the afternoon. But weight gain is a big one. Weight gain. Why am I gaining weight? Why can't I lose weight? That is a big one that tells you your body's out of balance. Why am I so tired? Why do my joints hurt? My back's starting to hurt. I'm feeling so old. That's what a lot of people say. I can't do as much as I used to in a day. I can't remember things. Why am I forgetting things? My job. I have some people come in and say, my job's at risk because I can't perform my duties. All of these itises of different organs, even I'm getting sick so many times, is telling me that their immune system is off, right? So almost any symptom, hair loss, anything that people get is a symptom of an imbalance. So I would say just kind of really pay attention to what itises are showing up. Some people come in and they're just like, "I don't know why I'm so anxious. I'm anxious all the time." That's an itis of the brain. So it really depends on any organ that can become inflamed and give you a symptom.
So you mentioned hair loss. What would be potential causes for someone who's losing, like clumps of hair or it's
Yeah.
coming out? It's one thing as you're getting older, especially males where they get the traditional pattern of baldness, but it's another thing when your hair's coming out, a little bit
Yeah.
more fast. What would
The
be
most the
that?
most common reason I see for hair loss is high cortisol, high stress. That happened a lot during COVID. The loneliness of COVID, the fear of COVID, the fear of the vaccination. There were so many reasons people were so stressed out during COVID, and a lot of hair loss. And cortisol causes hair loss. Cortisol, elevations of cortisol. Low progesterone can cause hair loss. So when people go through perimenopause or menopause, when women have premenstrual issues, vitamin D deficiency, iron deficiency, B vitamin deficiency, lysine deficiency, which is a protein deficiency. So when you think about deficiencies, I think about the gut. Is your gut absorbing things? Is your microbiome okay? Is there gut brain inflammation? What's going on that's making your scalp inflamed? Because that is a symptom of inflammation.
Great. And what tests would you suggest people get to make sure that they're in the right balance of health?
So along with the symptoms and their overall energy, just a height weight ratio. If you have, your height and your waist should be about half of your height in centimeters. That's a ideal body weight, because as we gain inflammation in our body and as we accumulate what's called visceral fat, our midsection starts to grow. And so that becomes an endocrine organ. It releases a lot of inflammation, and it releases a lot of problems in terms of other organs. So it sends signals to other organs to get inflamed. So just a waist circumference is one thing. Obviously, blood pressure. A BMI is a reasonable tool. It's not the end all be all. That's a height weight ratio, and it comes up with the number, whether you are normal weight, overweight, or obese. But that's not the end answer, because people with thin people can have inflammation, and overweight people can have high muscle mass. So it's not the end all be all, but it is one tool and a marker. So if you have that information, it's helpful. Then in the blood, I like to do CRP, which is a marker of inflammation. I like to do an expanded lipid panel. Everybody gets a fasting insulin and a hemoglobin A1C, which are markers for sugar control. Even if you don't have a history of diabetes, even if you don't have a family history of diabetes, we catch a lot of prediabetes. And the whole thing is about being proactive and understanding what your inflammation's about. We do markers for genetic predispositions for heart disease called ApoB and ApoE. We look at Lp(a), which is a marker for increasing plaque promotion. I'm looking at urine for just function of the kidney, and nutrients. So everybody gets vitamin D, B12, folate, zinc levels, iron levels, because they do a lot. And in my plant-based community, they do have deficiencies in some of these, and we have to supplement. But a lot of people have deficiencies, not just plant-based people. Red blood cell count, kidney liver tests. Those are kind of the fundamental basics, along with height, weight, blood pressure, and waist circumference.
So something that I've been hearing about a lot lately, and I don't know the veracity of it, even one of our speakers had brought it up on a panel last night, is oxalates in green vegetables. Is that something that we should be concerned about? If so, how do we minimize that? Obviously, green vegetables have so many wonderful characteristics and are extremely helpful. So what's
So I
the
see oxalate issues. Oxalate issues can look like joint pains, can look like systemic problems, but it can be secondary to the gut being inflamed as a microbiome level. I do oxalate testing on my organic acid tested. So I'm a functional medicine doctor. So I also do tests outside of LabCorp and Quest that look at something called organic acids and nutrients within the red blood cells. So that type of test shows me oxalate levels in people. And I see high oxalates when people have bad gut microbiome or have toxins in their system, like mold toxins. But I don't think it's a major problem for most people. I feel like it's a subset of people that have an oxalate issue. I really don't want to keep people from greens because they're so good for you. So just like nightshades, which can be problematic in certain individuals with arthritis, which are eggplant, peppers, tomatoes, potatoes, they can be very problematic along with sugar for arthritis. But I would never keep everyone away from that, because a subset of people have a problem with that, So I try different things for most people.
A major concern that you hear a lot of people complaining about nowadays, and I'm sure it was always a problem, but it seems to possibly have gotten worse, or people a little bit more conscious of it, is brain fog.
Mm-hmm.
What are a few items that people can do that you would think would help them reduce their brain fog?
So one would be to work on their insulin. So we are seeing a lot of brain fog in long haul COVID, which is from a completely different issue, which is tons of inflammation in the body, and also lack of perfusion to the brain, because a lot of people with brain fog have blood vessel issues that change as they lay down to sit up. So perfusion for the blood doesn't go into the brain, and that can result in brain fog. Hormone changes can result in brain fog. Low iron can result in brain fog. So the first thing would be to check someone's insulin level, because when people's insulin level and sugar control are off, that will result in fogginess and difficulty concentrating. That's a simple one, and looking at the gut microbiome. But in addition to that, I would say looking for inflammation within the body. So remember, gut brain is a big thing. I usually start with the gut, but working on your diet, adding more fiber, taking out inflammatory foods, making sure you're not iron deficient or B12 deficient or vitamin D deficient. Those are also important tools, as well as hormones. So when women go through menopause or men go through andropause, at least lower estrogen can cause brain fog, and lower testosterone in men can cause brain fog.
So during your presentation, you were talking about sugar, specifically in the context of glycemic index and its impact on insulin response. What is the role of fat with regard to insulin? Does insulin or does your body respond to fat with an insulin response at all, or is that neutral?
Think I'm not as clear that fat has a high signal on insulin as much as protein does. Protein can affect that pathway, but when people do things like keto, for example, keto diets are used in diabetic patients now to help control their insulin response. And that is a high fat diet. So I don't think they have detrimental effects as much as protein and carbs do on the insulin.
Thank you. All right, so I'm going to open up to our audience to ask a couple of questions. So, Sarah L., please state where you're from and ask your question.
Yes, hi there. I really appreciate this presentation. It's amazing.
Thank you.
So I'm from Maine, and my question is that for about the past few years, I've had this fairly chronic burning sensation in my stomach, and tests have shown that I've got inflammation on my small bowel. And I haven't eaten processed food for years. I eat a very, very healthy diet, and I'm not able to gain weight. My weight is really low, and I have osteoporosis.
Yeah.
My doctor thought it might have been something acid related, but Prilosec didn't help. My bowels are absolutely fine, so I'm underweight, and I have this burning that, and I have inflammation in my small bowel.
So the context of the inflammation in the small bowel, my issue would be to make sure you don't have any markers of inflammation that are suggestive of inflammatory bowel disease like calprotectin or lactoferrin in your stool, because that is small intestine is where you absorb a lot of nutrients. It's a very large area, but there are aspects of it, if it's inflamed, you will not absorb nutrients. So the level of severity of inflammation within your small bowel needs to be quantified. And if it is just something like small bowel overgrowth, that can be treated with antibiotics. But there are things that are beyond that in terms of mucosal disruption within the small intestine that can limit your ability to absorb. So I think I would work with someone who's more in tune to those kind of concepts to see where you're falling in that whole spectrum.
Okay, so just to understand, what you're telling me to do is get the specific amount of inflammation more documented, like quantified. And what test would that
Stool tests,
require?
and there's MREs, there's MRIs that look at inflammation within the small intestine.
Okay, thank you so much, doctor.
Okay, our next question is coming from Patrick M. Patrick M., please unmute yourself, state where you're from, and ask your question.
Thanks, Michael. New York. Thanks, Doctor. An excellent presentation. You mentioned in relation to the extended fasting, so the multi-day fasting, that there was a substantial benefit to the immune system. Could you give us a little more detail
The
on
5
that?
day, you mean the 5 day fast that I was talking about?
It was a 5 or 3, whatever you
Yeah.
mentioned.
So the fasting mimicking diet mimics a 5 day water fast, which has been shown to reset stem cells, which are these amazingly nubile, like very new cells within our body that can be whatever they want when they grow up. So they're untainted, they're not pre-diabetic, they're not autoimmune, they're not full of virus or anything. They're just very, very efficiently young cells that come out. And that comes out between day 3 and 4 of doing a water fast. And so that's a really great way to reset that immune system. Remember, I talked about how all the dysfunction of the immune system can happen. You can have autoimmune, you can have low activity to viruses and cancers, and you can have allergy type responses. And when you start to affect with stem cells and regeneration of the immune system, you start to kill off those negative cells and you start to build a whole new panel. And so repetitive use of this kind of concept with 5 day water fast is a very nice intervention for immune dysfunction. And that's on their website. So I can't talk as much about it right now, but if you go to Prolon or L Nutra as the company, they have a lot of information on it. Prolon mimics a fasting mimicking diet because it is very challenging to do 5 days of water fast for most people. But many people can do 1,100 calories on day 1 and 800 on the other days. I do it 3-4 times a year. And 1 or 2 of those times is with my patients. We do it as a Facebook group. And so it is a very effective way to see immune changes. And I've seen patients get better with some of their joint pains and some of their asthma and some of their immune dysregulated stuff. Is it a home run for everyone? No, but it's part of my toolkit to help people.
And is there something magic about the 5? I hear some discussion about 3 days. Is there?
I don't think the 3 days induces stem cells. I think you have to be fasting for 4. 3 days does do lots. So
Some
even a
things,
12-hour fast rests the gut, helps the insulin, changes the gut microbiome. In 3 days, you can start to increase resilience genes. Everything, every hours of fasting has a benefit. It's just in terms of the immune modulation, I think you have to get to day 4.
I see. Okay, thank you, Doctor.
So we just have a couple of minutes, and you were talking about gut health was obviously a major part of the presentation, and antibiotics is obviously a medication that's commonly administered. And I've heard, you know, of someone, for example, taking antibiotics for one thing and then afterwards getting shingles, then getting gout. How does taking antibiotics affect our overall health and make us susceptible to various illnesses? And is it possible that something like shingles after antibiotics or gout could be a thing, or is it unrelated?
So one, I want to just throw out there that antibiotics are very useful and people need them when they need them, right? So all meds have a role, but we have an overuse concept in America, right? We use them all the time, specifically in kids. So it keeps changing our gut microbiome, not in a favorable way, over 6 months. So one round of antibiotics can change for 6 months. And a round of probiotics can help, but it's not the end all be all. So it is absolutely can, when you get bad bugs, and if it could change our gut microbiome, when you don't have a resilient kind of a group of bacteria, you can create a dysfunctional state of gut flora that can then induce something called leaky gut or intestinal permeability. And that is a whole big ball game of anything's possible. You can actually induce changes that can lower your immune system, which leads you susceptible to shingles. You can activate it, which leads you susceptible to autoimmune. So I don't think it's hype. I just feel like it's not, don't be scared of one round of antibiotics for most people. But if there is a way not to use it for a sinus infection or something else that might be viral or allergic, then I would say, you know, let's try not to use it. But when we need it, we need it. Like antibiotics save lives. So I'm not going to say don't take antibiotics. But yes, the immune dysregulation from it is real. And I think it can start to affect different aspects of immune dysfunction in different capacities based on what that person started with. If I started with it and I took 2 rounds of antibiotics, maybe nothing happens. But if somebody else has only this much diversity and they take 8 rounds of antibiotics, anything's possible, because it's just about the change that happens and how many bad guys overpower the good guys.
Great. Thank you so much, Dr. Rao. It was a very informative presentation. So I'd like to thank you. And if we can, so your book, Body on Fire, obviously is available on Amazon and other book outlets. If you go through our bookstore, you can purchase it there, and The Real Truth About Health will get a little bit of funding to support our effort here to get this information out. If we can unmute the audience so they can share their appreciation.
Thank you so much,
you.
Dr. Rao.
Thank you.
Thank you so much.
You're the best.
Very
Thanks, Doctor.
Thank you,
Oh,
Michael.
yes.